Very often as a neurologist, I'm quite frequently asked in my medical practice about the treatment of hypertension, specifically regarding how to manage it effectively. And my answer to this is, well, classic. Hypertension is a symptom. High blood pressure is a symptom. It is necessary to determine the cause of the elevated blood pressure, eliminate that cause, and cure the hypertensive disease. Once again, hypertension is not a disease where you are prescribed pills and told you'll have to take them for the rest of your life. Hypertension needs to be cured. Hear this now. It needs to be cured so that your blood pressure doesn't rise above normal, and so you don't have to take blood pressure pills that lower your blood pressure. And it's important to understand that you can't just stop taking the pills you've already been using. Otherwise, you'll experience withdrawal syndrome, where someone who has been taking pills and suddenly stops will definitely have a spike in blood pressure, which can trigger a hypertensive crisis that may lead to serious problems like a stroke or heart attack. That's why hypertension needs to be cured. And when people ask me which pills to take, how to treat it, my answer is always the same. Hypertension needs to be cured. And that's precisely why I am always frequently asked, then esteemed doctor, please tell us in comprehensive detail how to effectively cure this persistent hypertension. Today we will meticulously go through a comprehensive step-by-step and truly detailed guide on precisely how to permanently cure your challenging hypertension. So let's start with the initial data. You need to determine what blood pressure is considered normal. Attention, friends. Normal systolic blood pressure for any person at any age, in any previous condition, with any other diseases, as well as with any duration of hypertension and prior treatment, is considered normal within a range. Not just a single number 120, but a range from 100 to 140, regardless of how the person feels. A range from 100 to 140 is considered normal for any person, but that's the upper value. The lower diastolic pressure is considered normal for a person if it is between 60 and 90, and any reading within these limits is considered normal. Hypertension, elevated blood pressure, as a manifestation of high blood pressure, is only diagnosed when the upper value is above 140 or the lower value is above 90. Or both at the same time. That's why it's very important to understand these numbers from the start so that we can refer to them later on. So the very first point, we establish for ourselves that our blood pressure should not exceed 140 and should not exceed 90. Second point, at this stage, we are already dealing with the fact that the person is taking and continues to take certain prescribed medications. We cannot stop these medications. We cannot stop taking these drugs because that would immediately trigger a hypertensive crisis. A hypertensive crisis is a very serious condition and can cause disturbances that pose a risk to a person's life. Absolutely not. We do not just stop taking the medications we have been taking up to this point. I will explain in a moment how you should eventually stop taking them. The second principle is to continue taking the medications. The third principle is to start looking for the cause of the hypertension, but we start searching by the method of exclusion. And the first thing I would recommend ruling out is a lack of water intake. We determine the person's weight. For example, we determine that the person weighs 100 kilograms. For a person weighing 100 kilograms, they need to drink between 3 and 3.5, closer to 3.5 liters of water per day. In other words, the amount of water you drink determines the condition of your kidneys and affects hypertension. If a person drinks little water, their blood pressure will rise. This doesn't apply to everyone. It doesn't work 100% of the time. But in most cases, hypertension is a disease of people who drink little water. And that's why this is the most important factor. We start drinking water in the amount that we need according to our weight. Do you weigh 60 kilograms? You need to drink 2 liters of water. Do you weigh 150 kilograms? Well, sorry. For the kidneys to flush out such a body, they need 5 liters of water. The calculation is based on the rule 30 kilograms of body weight equals 1 liter of water to drink. And as practice shows from my personal experience, about 95% of people with hypertension give up at this stage. They don't drink water. They don't start drinking water. They complain that everything Dr. Golod said doesn't work. And do you know why it doesn't work? Because people don't drink water. They just don't drink water. They come up with 1,000 reasons that they have to run to the bathroom all the time. Well, that's cystitis. You need to treat that. That their blood pressure starts to rise from drinking water. Well, that's not the only reason. There are others too. We'll talk about those as well in a moment. But until a person starts drinking enough water, I repeat, in 95% of cases, treatment for hypertension will fail. In the third stage, we drink enough water. At the fourth stage, very often just drinking water alone is not enough to solve the problem of hypertension. Because a person's kidneys are not functioning as they should. Inflamed kidneys, most often pyelonephritis, and most often they are accompanied by cystitis. This is also accompanied by the formation of sand in the kidneys and later stones. And here, you need to help the kidneys themselves. The kidneys don't work because they don't receive enough energy, enough warmth. This problem is solved as follows. There are products made from turmanium ceramic. I'm showing a turmanium belt. Although it doesn't have to be a belt, it could be a mat, anything at all. What matters is that it's turmanium ceramic and I need the warmth from the turmanium ceramic, the kind of warmth that's compatible with my body. We wrap the body with turmanium ceramic and warm the kidneys for about an hour a day, usually in the evening. The temperature should be 50 to 55 degrees and you need to warm up for at least an hour. It's hard to warm up the kidneys. Then after the kidneys, we wrap the legs, the shins and thighs, not the feet, the shins and thighs, and warm the legs additionally. In fact, we warm the legs until they actually sweat. Be sure to warm your legs to the point where they start sweating in the evenings before going to bed so that you don't have to go anywhere afterward. Well, your legs might not start sweating right away. That's an acceptable outcome. It's possible, but we still keep warming the legs, warming and warming. Warming up the legs by itself will already help lower blood pressure, but that's not the reason why I warm up my legs. It's necessary that warming up the kidneys and legs eliminates inflammation in the kidneys so that the kidneys start functioning. By the way, if your feet are cold, yes, cold feet are a factor that leads to kidney inflammation. The kidneys stop working, and this is a cause of hypertension in a person. So at this stage, we start warming up the kidneys and the legs, and this solves the problem if it's due to inflammation. Often this is not enough because heart problems also come into play. But when it comes to heart problems, it's an issue of stress. It's not that the heart itself works this way on its own. This disorder comes from the nervous system. Stress factors. But if we try to deal with stress factors using only sedatives, we might calm the nerves, but we won't calm things down when stress hormones like adrenaline and noradrenaline are being released. How can we lower their levels? Actually, it's quite simple. Through muscle activity, through physical exercise. And in such cases, I recommend simply going out for a walk at a brisk pace as an anti-stress measure, walking a bit, working out a little at the gym, riding a stationary bike, giving yourself some physical muscular activity that eliminates the stress factors causing hypertension. This is also a crucial factor for lowering and normalizing blood pressure. Well, that's good. We're already exercising, we're already going for walks, but very often hypertension is still caused by excess weight. There's nothing else I can do to help here. You need to lose weight. By the way, for the same physical activity, I use myostimulation to help reduce weight. To lose weight, you need to normalize your diet. In other words, a person shouldn't eat so much. The difference is that a person can eat a normal amount of food in the morning and not gain weight. But anything they eat in the evening will make them gain weight. Change your meal times, normalize them, even count calories a bit so your diet is more balanced. And weight loss is also a factor in normalizing a person's blood pressure, the next factor. And then, friends, there's one important point. How do you cure hypertension? How do you stop taking pills? Listen carefully. This is the key point. After that, I recommend measuring your blood pressure 3 times a day, 3 times a day. So we keep taking the pills, we keep warming the kidneys, drinking water, running, exercising, losing weight. and measuring our blood pressure. Now pay attention. And to stop taking pills, all you need to do is skip a dose when your blood pressure is normal. So you started applying the factors to eliminate the causes of high blood pressure. Great. And you measure that today your blood pressure is 135/85. This blood pressure is within the normal range regardless of how you feel. And at this point, we skip the next pill. The next morning, we measured that the blood pressure was already 170. We take our usual pill. At lunchtime, our blood pressure is normal, so we skip the pill. We skip taking the medication every time we measure normal blood pressure. And when we measure it slightly elevated, yes, to lower it, we will continue taking the medication for a while longer. And over time, you'll notice that you have to take fewer and fewer pills right up to the point where your blood pressure stops rising above normal, and you no longer need to take medication to lower it. It's all very simple. You can't just throw away the pills. You'll have a hypertensive crisis. But in order to stop taking them, you first need to cure the hypertension. And to cure hypertension means to eliminate the causes that lead to high blood pressure. So that's the information for you today about how to cure hypertension and completely stop taking antihypertensive or blood pressure lowering pills. That's it.